Kukoro. We don't have enough time. You're welcome back, ladies and gentlemen. We are quickly going to have Ladonette ONI before we have the news in brief, which is going to be at exactly 8 a.m. Good morning, Ladonette.
Good morning to
how
you,
are you
Sandrine?
this morning?
I'm beautiful. And how is everybody?
We're fine. By God's grace, we are alive. Well, let's quickly rush through the statistics of coronavirus this morning.
Okay, first we have the Minister of Higher Education, Jacques Famendongo, that had an online conference with heads of different universities, and they had to talk about the school resumption and everything. You know, I'm happy because school is going to start on the 1st of June, and he made it like that was one of the agreements that, one of the conclusions that they came with during that meeting, that school is going to resume on the 1st of June, and that, that the classes will start, it starts on the 1st of June, and it's going to end on the 30th of August. It's going to end on the 30th of August. And they will resume a new school year on the 15th of October.
Oh.
So you see how the school years, this academic year is just going to change and everything. And now we start school on the 1st of June, and we have 8 weeks to have that we're going to go have classics and everything. And also, like I was saying earlier, the reamendment of the school calendar, classes will end on the 30th of August and start on the 15th of October. And that every populated department in the University of Douala, we have departments that have over 200 students, over 100 students. Those departments would be like, in order to respect social distancing, they'll have to reduce the number of students there, like divide the classes and the course into 3 or something more, depending on the students that are in that course, offering that course, and they'll take a larger hall so it can contain those children and the students, and they could respect the 1 meter distance.
I actually saw a funny post on Facebook of a guy who wrote and said, you are happy about social distancing. If they practice social distancing during exams,
what is going to happen?
How are you going to pass your exams?
Okay, and
that was just an aside
still on that, he says there will be a constant disinfection of classes, and as well as hand washing posts to be created in front of every class and administrative blocks, and also the health centers will be equipped to take care of these students, because it's really important. I cannot remember the last time I went to a health center in the University of Douala, and the one I visited the time I was registering for the university was not that good. It wasn't really equipped, and so it's really an opportunity for everybody to be involved, everybody to get conscious and make sure that universities are well equipped with all medical facilities to take care of all the students in that university. And now there's something that's so shocking. He says the e-learning started on the 13th of April, but in the University of Douala, my faculty to be precise, links have been sent, that's true, but it's not easy to gain access to those links. You just see errors every time you do, and they say you need to put a password, you create a password following the instructions given, but at the same time it still doesn't give you access to those platforms. So it is really disturbing. It's really disturbing. Other faculties, they do have access to that easily, but it's not every faculty that has access to it. Some faculties usually face error while accessing those platforms. So it's really something for the university to look into, so every student can gain access to those platforms and continue learning.
Wow,
now,
really
we move it further. The far north region of Cameroon has registered its first COVID-19 case. All the 10 regions of Cameroon are now infected by the virus. And Cameroon has more than 1,800 infected cases, with over 934 recoveries and 61 deaths. So we're reaching to 1,000 recoveries very soon. It's positive. Now, the Archbishop of the Douala Archdiocese, Samuel Clether, had a press conference yesterday where he invited some media organs, and he stated that his herbal medicine is effective in curing the COVID-19.
Okay.
Yeah, that it's effective.
Finally out.
It's effective. In curing the COVID-19.
For the symptoms and respiratory problems.
Yes, and he intends organizing a massive production of this drug so it can help the Cameroon population. Sandrine, the other day we did a Vox paper that had to talk on what people think about Clether's remedy and everything. They say they are happy that somebody has done an effort in doing that kind of thing, and coming from the Archbishop himself, it means that he is sure of what he he's saying. Because of he is an archbishop, and for him to make such claims, it's something that people would obviously believe in it. And they're like, if it's really more tested and confirmed that it cures coronavirus, then everybody will want to take it. Nobody will want to leave it out. People will obviously rush to getting it because yes, it has, and he says it will be available in all Catholic hospitals nationwide.
Okay.
Yeah.
So note, it's for free.
Yeah, and it's for free. Yeah. Thank you so much. It's for free. And Miss Cameroon, in collaboration with Modbi Nama International, visited the Obam Catholic Church distributing COVID-19 kits. Not just that, they have been like, I'll tell you, the Miss Cameroon and her girls have been really active during this period.
Yeah, they've really, is one Miss who has really been active.
Yes, she has really been active during this period. She's distributing, visiting different places in the nation's capital, Yaoundé, and distributing different kits to help people, because I could see that the last time I told them we spoke about her, she distributed it to the less privileged. She distributed it to beggars. She distributed it to disabled persons, and that was a good move. So we end it all today for the Cameroon updates. We'll move over to Africa. Coronavirus in Africa surpasses over 34,000 with more than 1,500 deaths and more than 11,100 recoveries in the 56 territories. Now, Nigeria will ease new coronavirus lockdown in 3 key states over a 6-week period from the 4th of May.
Okay.
Yes. And now Tunisia will start relaxing its lockdown as well to slow the speed the speed of the coronavirus next week, with first sectors being the food industry, construction, and half of the public service. Now, more than 300 cases of people infected with COVID-19 were detected in 3 prisons in Morocco. So more than 300 cases of affected persons were detected in 3 prisons in Morocco after a screening campaign was conducted in the 73 prisons of the kingdom. Now,
that's huge.
Yeah, that's huge. That's huge. And not just prisoners as well as gardeners are all guards are all infected. So the 300 it's not just prisoners. We have prisoners and the guards as well. They both are infected with the COVID-19. It's really an alarming thing because, prisons, how populated they are. And if 300 people have been spotted, you don't know how far that virus has gone. So it's really time for people to really evaluate prisons, look at prisons, and not just that, disinfect prisons as well. It's time for states to organize disinfection campaigns in prisons, not just disinfecting schools, markets, but you should go into prisons and disinfect prisons as well, because washing of hands in prisons and also wearing a face mask will not limit that much of the contamination and spread. Disinfection will go a long way. Now, South Africa remains the country with the highest number of confirmed cases, with more than 5,000 confirmed cases, and it's followed by Egypt, Morocco, Algeria, and Cameroon. And from Cameroon, we have Nigeria, Ghana, Guinea, Ivory Coast. But it should be noted that Algeria has the highest number of deaths in the whole of Africa. That is over 444 deaths, and is followed by Egypt, Morocco, and South Africa. And for recoveries, South Africa tops recoveries as well.
Wow.
Yeah, they are topping recoveries because they have more than 2,000 recovery patients. So even though they are having 5,000, they are doing something. And I want to tell you, South Africa is that country in Africa that has launched a massive campaign, massive testing, because there's this ideology all over the world that Africa has not developed or found out more confirmed cases because they have not been carrying out large testing. They have not gone out to do testing in large number of groups. But South Africa is one country in Africa that has done that. Not just South Africa, other countries are doing it. Cameroon is doing a door-to-door campaign as well. So anyways, that's all for coronavirus.
Thank you, darling. We hope that you would get more time to elaborate more on the topic in subsequent editions of the show. We are going to continue right now. It's time for the news in brief right here on Good Morning Cameroon. For those who have just joined in, you're welcome to join the big family. Good morning to you all, and happy birthday to all those who are observing a +1 this beautiful morning. I think the news is actually going to be right now.
Matama. Ubapo yuga.
Uti yule.
Mbolo. Martin Chubla. Soko biwo amba. Menabuna ngabuki maholio. Jamna.
Agazana am yofu.
Abala. Benga chiangu. Bolong.
Dari jam iko jam madala.
Bef mo se patwa.
Monsieur Songno kala.
Ma fin la andi lam.
Ebi muduko. Gavine ron la top.